Hey guys, welcome back to the channel. If you're new here, you're very welcome. My name is Couscous and this is the Get Ahead family. In today's video, I'm going to be taking you through how to access healthcare in the UK with your UK student healthcare insurance. Okay, remember that when you were paying for your visa, you had to pay for health insurance. As an international student, before you are issued a UK student visa, you have to pay for the IHS surcharge, which is meant to cover your health insurance. So that's what this video is going to be about. If it is something that you're interested in, do stay tuned and ensure to join the family by subscribing so that you will not miss any of my content. So let's get right into the video. So as an international student in the UK, these are the things you need to know so that you can be able to access your health insurance in the UK after you have paid your IHS surcharge. The first thing you have to do is register with a GP. A GP is a general practitioner. So you will be advised to register with a GP near you. Usually universities have GPs that are registered under them. So most times if you're living within campus, it will be advisable that you register with the GP within your university or closest to your university. However, if you do not live close to your university and you live away from the university, there would definitely be GP services closer to you rather than the ones in your university. For instance, I lived in East London and my campus was in Central London. I did not bother to register with a GP in Central London knowing that I resided in East London. So what I did was I registered with a GP nearest to me in East London and it was less than 2 minutes walk away. So in order to be able to access healthcare, you have to register with a GP. How do you register with a GP? Usually you may have to go to the NHS website and search for the nearest GP closest to you, and when you search for it and identify based on your postcode and your address, different general practitioners closest to you would pop up and then you can be able to register with them. If you are in London, however, you can download the app Dr. IQ. Dr. IQ would allow you to access healthcare with your GP through the app. So what you can do is register on Dr. IQ and you can be able to access healthcare. If you are in other cities, I do not really know what apps are applicable to them, but all you need to do is check for general practitioners nearest to me, use your postcode, and you'll see a couple of them, and then they'll ask you to register. Then you can register with them. Usually they'll ask you for your name, your address, your phone number, your date of birth, very few information that you need, and they may even ask you of a bit of your medical history so that they will know how to properly attend to you when you need healthcare. What you need to know is that in the UK, you have to be able to get healthcare properly, especially in times of emergency. There are different drugs, different medications that you cannot access over the counter. When it has to do with pain relievers, flu drugs, you can easily get them over the counter. However, if it is a prescription drug, you would need to meet a doctor who would then prescribe this drug for you to be able to have access to them. And you cannot do that except to register with a GP. So actually, you can choose to register with any GP at all within the UK. However, it is recommended that you register with GPs closest to you so that in times of emergency, you can be able to easily get medical attention. Now, how do you access healthcare? What you need to know is that in the UK, most times you would get healthcare online because it is not advisable that you go into the clinic, especially when you can get advice or you can consult with a doctor online. I think this development was brought about by COVID-19 when there were a lot of restrictions in human interaction. So going forward, it is recommended that you first make contact with your GP online, and when they ask you to come in for an appointment, you can now go to the hospital. So what do? Let's say you have persistent migraine. You have persistent migraine and you have used over-the-counter medications and they are not going. What do? For those in London, I have advised that you download Dr. IQ. When you download Dr. IQ, they are going to ask you who is your GP. You would click, you will identify your GP, and you will have access. So whenever you have issues, you can go to the app and they'll ask you what do you need. You would list out your symptoms on the app and you register your complaint. when you register your complaint, they will definitely get back to you within the app on what to do. A doctor might reach out to you within the app, or a doctor might call you. However, let's just say you are not in London and you do not have Dr. IQ. What do? You call your GP. So first of all, when you register with your GP, you should be able to get their phone number, their customer care line. However, let's just say that you do not have it. All the NHS, guys, all the NHS, you don't have NHS number? Go to the website, go to the NHS website. So when you call NHS customer care, you'll be like, hi, my name is Couscous and I want to reach out to my GP. I'm having symptoms of this, that. They're definitely going to ask you for your date of birth and your address. Once they ask you for your date of birth and your address, they will confirm your GP. That is when you have registered. This is why you should register with a GP. Because if you do not register with a GP and you call NHS, they will still ask you to go register with a GP. So when you call NHS, they'll get your date of birth and your address. They will confirm your GP and they will ask you, would you like us to schedule an appointment with your GP for you? You say yes. Most times I'll just say yes. And they'll be like, okay. They would schedule an appointment and inform your GP to call you. So usually your GP will call you. It's either the customer care at your GP, the hospital, will call you, or a doctor will call you directly. Sometimes they will send a text and say, oh, your appointment is for 1 p.m. Your appointment is between 1 p.m. and 1:30, and your GP will call you within that time. And usually they'll call you within that time or a little bit later. If your GP calls you, it could either be that it is the customer care that is calling you or the doctor. If it is the doctor directly, good. They will introduce themselves and tell you, oh, my name is this, Dr. This. I'm calling from your GP. You laid a complaint about this. How are you feeling now? What have you done? And this is what you should do. They'll tell you what to do. That's how you can access medical care using the UK Student Health Insurance. When your GP has finished consulting with you, they may either tell you to come into the hospital based on your symptoms, or they would ask you, for instance, if you have any skin blemish. Like there was a time I was breaking out a lot and I used over-the-counter topical creams and it did not work, and I had to log in or register my consent with my GP and I booked a consultation. If you're doing it in-app like Dr. IQ app, they're going to ask you, okay, if you are comfortable, would you mind taking a picture of the skin blemish you have? If it is acne, they'll ask you to take a picture of the places you have the acne so that they can properly make their assessment. So after you have consulted the doctor, they may either make prescriptions or they will ask you to come into the hospital. So usually, if they make a prescription, they'll ask you, okay, this and this and this, I'm going to prescribe this for you and I'll need you to go pick it up at the pharmacy. Then they'll ask you which pharmacy is closest to you, because they would want you to go to the pharmacy and pick up the drugs, the pharmacy that is closest to you. So all you need to do is, somebody like me, I lived 10 minutes away from the mall and there was Boots Pharmacy inside the mall. So I usually just put the Boots Pharmacy closest to me. And you would tell them, they will confirm that, okay, this is the pharmacy you want your medications to be sent to, and then you would go to that pharmacy. When they send the prescription to the pharmacy, it is usually not ready in 24 hours, okay? Sometimes they will say, okay, Kusame, we have sent the prescription and you can go and pick it up tomorrow, or you can pick it up in 48 hours. If it is an emergency, you can tell them that, oh, you really need this immediately, and you can ask them to call the pharmacy to make sure that your prescription is ready so you can easily pick it up. Now, so when you go to the pharmacy to pick up your medication, try to register your phone number with them. Why am I saying this? When you register your phone number with the pharmacy, anytime your GP sends a prescription for you in that pharmacy, they are going to send you a text message to inform you when your prescription is ready for pickup. Otherwise, you will just go, they tell you that your prescription is not ready. And you're like, but this prescription was given to me yesterday or 48 hours ago or 72 hours ago. And they say, oh, sorry, your prescription is not ready. Oh, Kusame. But if you already know that when your prescription is ready, they are going to send you a text. Or you can even call them to ask, is my prescription ready, before you start going. You would be able to manage your frustration. Because I know a lot of times that the GP has sent a prescription and I go there, it is not available for pickup, maybe because it is out of stock in that pharmacy and they need to bring you from a different location. So that's why when you go there, ask them, oh, can I register my phone number? So that whenever your GP sends a medication, they can send a text message when it is ready and you can go and pick it up. So usually each prescription is around £9 something. So for instance, the doctor prescribed like 3 different medications. That is one prescription. So when you go to pick it up, you'll pay £9. But if you lay a complaint today and the doctor makes a prescription, you lay another complaint tomorrow, doctor makes a prescription tomorrow, you lay another complaint, in 1 week you lay 3 complaints at 3 different times and they make 3 different prescriptions. Be rest assured that when you are going to pick up that medication, you're going to pay £9 in 3 places, because definitely there are 3 different prescriptions. But if you know that you have different symptoms, log them in all at once, lay the complaint with your doctor once and for all, so that they make all the prescriptions at once and you can pay once, just for one prescription and pick up all your medications. Somebody might want to ask, oh, Couscous, so I registered with a GP in this particular place, but I have moved from that accommodation, I have changed my address, what can I do? It is very easy for you to switch your GP, as well as to switch the pharmacy that you're going to get your prescription medications. So what you can do anytime you want to change your GP, you can cancel your registration with this particular GP and register with another GP. It is not just change of address that should make you change your GP. Sometimes you might register with a GP that is not responsive, or that takes them forever to respond. Maybe you've had the first, second, and third encounters. Maybe you've logged in complaints, you've called them, and they say, oh, they're going to call you back, and they end up not calling you. Or you go to the hospital, they don't attend to you. They say, oh, log in. We have a lot of consultations today. Our slots are booked. Drop your name, drop your phone number. We are going to call you, and they end up not doing it. Or generally, you do not just like their service. You can change your GP. It will not cost you anything to change your GP. If you know any GP that is responsive, that is not so far away from you, change your GP, register with a new one, cancel the other one, and then you can easily register with a new GP. Also, if you change your location or you don't want to pick up your drugs in this particular pharmacy, maybe because every single time you go there, it's either the drugs, the prescription is not available, or it takes them too long to make it available, or you change your location, you can also change the address of the pharmacy that you want to pick up your prescription. So all you need to do is, when you have a consultation with your GP and they want to make prescription, they're going to ask you, where would you like to pick up the prescription, and then you provide a new address. That is how to access medical care using your UK student health insurance. There are so many things that you can access. Usually when you want specialist health care like dental or optical health care, you would have to first consult with your general practitioner, your GP, and let them know your issues. Then you would ask your GP to refer you to a dental or optical clinic for a service. If you have eye issues, if you want to do anything that has to do with dental care, your GP has to refer you. I remember when I had my skin concerns, I had a lot of acne and I needed to treat it. Topical products from over the counter was not treating it. And usually I will log a complaint on Dr. IQ, and then they're gonna ask me, what are my symptoms? What am I using? And then I'll tell them. Then they will make a prescription. Oh, Couscous, go to your pharmacy and pick up this prescription. They'll tell you how to use it. I go pick it up. I use it for 1 week. The second week, it doesn't work again. Or I use it for like 3 weeks or 1 month. I don't see changes. I go back again and report. Whatever you do, they're going to ask you, what are you using? How long have you been using? So at a point, I was on this for like 6 months, going back and forth with the GP that, oh, this thing you prescribe is not working for me. And I was like, could you refer me to a dermatologist? They're like, the first step is not to refer you to a dermatologist. They have to first try everything they have to do first, and if it does not work, they can now refer you to a dermatologist. So what am I trying to say? I'm trying to say that you will not be able to get specialist healthcare directly using a UK health insurance, but you can get it by letting your GP know that these are the services you want. I want dental service, I want optical service, and ask them to refer you. Then your GP will give you a referral letter that you would take with you to the specialist medical health care that you want to get. Your GP may even be the one to call the specialist clinic and get an appointment for you. Then they will let you know that, oh, you have an appointment on so and so. They come in and get your referral letter, and then that clinic ideally would also send you a text message closer to your appointment time so that you don't forget your appointment. So whatever you do not understand, ask your GP. Your GP should always be the first point of call. And if you're finding it difficult to reach your GP, call the NHS. Me, I don't used to waste time. Hey, me, small thing like this, I don't call NHS because I feel like sometimes it is easier to even reach your GP through the NHS. You call them and say, it's an emergency. I need an appointment. I need it. No. They will reach out to your GP and they'll schedule an appointment for you. Another thing you need to note about Dr. IQ is that there are times that you need to book an appointment because appointments are taken up very fast. For instance, when I was there, if you need to make any consultation or register any complaint on the app, it will be between 7 a.m. and 9 a.m. because after those times, they'll tell you, all our appointments have been booked for the day. You have to wait for the next day.
What? Are you playing? What type of playing is this?
So, what am I trying to say? You have to understand what are the times I can call my GP to book an appointment, because this also applies to your GP. There are times that you call your GP to book an appointment. They say, oh, all the appointments are closed today. Call back tomorrow by so and so time. And also, they will give you a window. Usually, maybe they would say, oh, we start taking appointment booking between 8 a.m. and 10 a.m. every day. This is what you should know. When you register with your GP, ask them, okay, what time are your appointment hours? What time do I have to call in? So that you have these numbers and this time at your fingertip, because sometimes it could be very frustrating when you want to get a service. They tell you, oh, it is too late for today, call back tomorrow. It could be very, very frustrating. Usually, if you call your GP and they recommend that you have to do a blood test, they will refer you to a particular clinic where you have to go in and then take your blood test. With your UK student insurance, you can access a lot of healthcare services for free. And anyone that is not free, your GP will definitely tell you. So don't be afraid to reach out to your GP for medical care because you feel like, oh, it is a lot. They attend to you on everything. See, let me tell you, a lot of tests are free. HIV tests, pregnancy tests, STD tests, contraceptive, a lot of things are free. Take advantage of them. Eye tests, glasses, they have limits, but what you should do is first get the free service. When you are done getting the free service, whenever it is time for you to pay, they will definitely tell you. So guys, I hope that this video has been helpful, because I know that you guys are just resuming school and you may not remember to sort out your healthcare, and it might be time for emergency and you're not able to pull through. So when you do these things, register with a GP, get their contact details, get the NHS contact details on your phone, know the pharmacy you're going to be picking up your drugs from, and know how much you're going to pay per prescription, know the appointment times with your GP, know when to log a complaint on the app so that you get feedback easily. When you know all these things, it is easier for you to get healthcare. I really did not have challenges getting healthcare, except for the time where I wanted them to refer me to a dermatologist, and they told me that I have to first go through the processes before I get to a dermatologist. After a while, they eventually referred me to a dermatologist. So yes, there are lots of things that you should take advantage of. Guys, ask questions. Whenever you're confused, ask questions. And I hope that this video has answered a lot of your questions on how to get medical care using your UK student health insurance. So if you have any questions, put it in the comment section. Couscous is always here to answer your questions. If you are a student who have recently arrived in the UK, I have a lot of videos that can help you. Most recent one and most important one that is good for you is on how to access student discounts in the UK. In that video, I shared a lot of information on the different websites that you can use to access student discounts. So you should check it out. After this video, I'm going to link it in the end screen so that you can check that video out. And if you have any video recommendations, drop it in the comment section and I'll provide videos on those issues for you. So that's it guys for this video. Do well to watch this other video about student discount, and don't forget, join the Get Ahead family. Like, share, subscribe, and I'll catch you in my next video. Bye bye.